The isolation of HIV-1 MN marked a turning point in the fight against HIV/AIDS. This particular strain of the virus, identified in the late 1980s, provided researchers with a critical tool to better understand the virus's behavior and characteristics. Its unique characteristics made it an invaluable tool for researchers, paving the way for groundbreaking discoveries that transformed the landscape of HIV diagnostics and treatment. The ability to study HIV-1 MN in detail allowed scientists to uncover the virus's mechanisms of infection and replication. The development of accurate and reliable diagnostic tests was arguably one of the most significant contributions of HIV-1 MN. These tests revolutionized the way HIV was detected, moving from a reliance on clinical symptoms to precise laboratory-based diagnostics. Before these tests, diagnosing HIV was a challenge, relying heavily on clinical symptoms that were often nonspecific and could mimic other illnesses. This often led to misdiagnosis and delayed treatment, exacerbating the spread of the virus. The availability of HIV-1 MN allowed for the development of blood tests that could detect antibodies to the virus, providing a more definitive diagnosis and enabling early detection and intervention. Early diagnosis is crucial in managing HIV, as it allows for timely treatment and reduces the risk of transmission. HIV-1 MN also played a pivotal role in the development of the first generation of antiretroviral drugs. These drugs were designed to inhibit the replication of HIV, and their development marked a significant milestone in the treatment of HIV/AIDS. These drugs, designed to inhibit the replication of HIV, were initially tested using HIV-1 MN in laboratory settings. The strain's high replicative capacity and susceptibility to these early drugs allowed researchers to evaluate their efficacy and pave the way for clinical trials. The strain's high replicative capacity and susceptibility to these early drugs allowed researchers to evaluate their efficacy and pave the way for clinical trials. This process was crucial in ensuring that the drugs were safe and effective for use in humans. The development of AZT, the first drug approved for the treatment of HIV/AIDS, was a direct result of research conducted using HIV-1 MN. AZT, or zidovudine, was a groundbreaking drug that offered the first glimmer of hope in the fight against HIV/AIDS. This breakthrough drug, while not a cure, offered a glimmer of hope in the fight against this deadly disease. It demonstrated that HIV could be managed with medication, significantly improving the quality of life for those living with the virus. It marked the beginning of a new era in HIV treatment, one where the disease could be managed, and lives could be prolonged. The success of AZT paved the way for the development of more advanced antiretroviral therapies that are used today. The legacy of HIV-1 MN extends beyond these early breakthroughs. The strain continues to be used in research today, helping scientists develop new and improved diagnostic tools, more effective antiretroviral therapies, and potential vaccines. The strain continues to be used in research today, helping scientists develop new and improved diagnostic tools, more effective antiretroviral therapies, and potential vaccines. The ongoing research ensures that we are continually improving our understanding and management of HIV. Its contribution to the fight against HIV/AIDS is immeasurable, a testament to the power of scientific research and the importance of collaboration in the face of global health challenges. The story of HIV-1 MN is a powerful reminder of how far we have come and the importance of continued research and innovation in the fight against